know you've been waiting patiently. You were first in the room, but we'll start the call list. I don't want to interrupt in the middle of a story, Senator. No. Good afternoon. This is the Standing Committee on Health for May 24th, 2016. We have a number of senators have given us their proxy. We were waiting because Senator Rivera and myself were delayed. There was the Veterans Hall of Fame ceremony. And
good reason to be delayed.
And they called us by alphabetical order, so that's why I got here before Senator Rivera. And welcome to members of the hospital trustees from around the state. Thanks for joining with us. The first bill, Senate 1054. Counselor?
This amends the hospital and nursing home patient bill of rights to ensure patients are informed of their civil and religious liberties.
Discussion?
No.
Bill is reported. Senate 2060A.
Establishes a public umbilical cord blood banking program.
Discussion? Bill is reported. Senate 2545C.
Requires healthcare plans to provide an expedited review of applications of healthcare professionals joining group practices.
Discussion? Bill is reported. Senate 3020, Senator Young.
Authorizes the Commissioner of Health to include dentists in the Doctors Across New York program.
Discussion? The bill is reported. Senate 4736.
Allows healthcare facilities to directly or indirectly divide fees to pay for practice management, billing, or health information technology services.
Discussion? Bill is reported. Senate 4918.
Requires businesses open to the public that have a toilet facility for employees allow any individual with a qualifying medical condition to access such facility.
Discussion? Bill is reported. Senate 5048, Senator Kennedy.
This requires birth centers to provide leaflets and request parents view a video on safe sleeping practices.
Discussion?
Without rec from Senator Montgomery.
Okay. Bill is reported. Senate 5100.
Requires hospital birth centers include the American Academy of Pediatric recommendations for safe sleeping practices in the leaflet distributed to new parents.
Discussion? Bill is reported. 5466.
Requires information leaflets distributed by hospital to maternity patients include information on the danger of window blinds.
Discussion? Bill is reported. 5522B.
Authorizes diagnostic and treatment centers and outpatient clinics of general hospitals to make house calls.
Discussion? Bill is reported. Senate 5789.
Requires the Commissioner of Health to establish and promote the maintenance of a statewide telehealth network.
Discussion? Bill is reported. Senate 5852.
Ensures home care services provided by telehealth are provided by licensed or certified home care providers, and that these services shall not count towards any number limitation.
Discussion? Bill is reported. Senator 6026, Senator Kennedy.
Requires airports provide a nursing space for breastfeeding mothers.
This bill is being reported to Transportation. I have no idea how it got in this committee, but I thought they would have a more appropriate jurisdiction. So, bill is reported to Transportation. Senate 6492.
Requires insurers make determinations on authorization for post-acute care within 24 hours.
Discussion? Bill is reported. Senate 6583.
Provides Medicaid coverage for donor breast milk.
Discussion? Bill is reported. Senate 6730.
Requires the distribution upon discharge of a maternity patient of information regarding crib safety.
Discussion? Bill is reported. Senate 7049.
Ensures participants in the WIC program have access to all approved products, including exempt formulas at any approved vendor.
Discussion?
Without rec from Senator Montgomery. Hold on, a lot of pages, gives me a second. Senator Montgomery, Senator Broussard,
So 2 no without Rex?
I think there are 4. Senator Montgomery, Senator Prasad, and myself. Those are the 3.
There are without Rex from Senator Montgomery, Senator Rivera, Senator Prasad? Okay. Bill is reported. Senate 7369.
Requires the Department of Health to conduct education and provide information regarding the meaning and potential consequences of having dense breast tissue.
Discussion? Bill is reported. 7505.
Allows for the disclosure of HIV-related medical information to qualified researchers.
Without Rex, that was it came to us from the Law Review Commission of all things. So if you want to discuss it later.
And Senator Montgomery as well.
Okay.
Without
Two without Rex.
So sorry, just for a moment. So how does that work without the confidence? Will they get permission or not? It says to allow disclosure of confidential information.
It's under restrictions. First of all, it has to be done, approved by a IRB, Institutional Review Board, and then it's still confidential to the researchers.
But it's without their information, their permission.
Well, they've already consented to the test. The
Right.
test would otherwise be totally confidential. This is so there can be research about it and obviously lead to a better way of treating the disease.
Yeah, no, I understand. I just want to know whether they're giving permission.
The individual person?
Yeah.
No.
Thank you.
Okay, the bill, without discussion, and the bill will be reported to the Codes Committee. So the bill is so reported. Senate 7529.
Provides for education regarding living donation and ensures that those who donate are eligible for paid family leave and protected against insurance discrimination.
Bless you. The bill is reported. Senate 7689.
Adds at least 3 representatives of managed care plans to the Early Intervention Coordinating Council.
Discussion? Bill is reported. Senate 7801.
Provides for the transfer of electronic prescriptions.
This is the transfer from one pharmacy to the next. It's been the most reported problem that has come up with e-prescribing. Discussion? Bill is reported. And the last bill, 7873.
Ensures that future healthcare costs are properly paid by the Medical Indemnity Fund and provides an impartial review process for claim denials.
Discussion? The bill is reported. Thank you very much for your patience on a very long agenda. There will be one more committee meeting before we go to rules.